Good afternoon. I'm Dr. Rajendra Prasad, a neurosurgeon and a spine surgeon. So I've been working at Indraprasth Apollo Hospital for the last 22 years now. And before that, I was working in England. Um, many years into our training as a neurosurgeon, most of us in UK realized that some amount of orthopedic spine training was necessary. And since then, many orthopedic surgeons have realized that some amount of neurosurgical training is necessary. So now we have this common question asked that I have a spine problem, who should I see? Should I see an orthopedic surgeon or should I see a neurosurgeon? And the answer to that is you see a spine surgeon, because there are now, like myself, a group of people who are either neurosurgeons or orthopedic surgeons, but have had training in both. Because you need neurosurgical training to operate on the spine. The kind of skills that one has as a neurosurgeon, like using the microscope and care and respect for nerves and spinal cord, those things you learn as a neurosurgeon, whereas as an orthopedic surgeon, you know and learn how to treat fractured bones, injured bones, infected bones. So the spine in the body really has all of these. They have bones, they have nerves, there are muscles, and therefore pain can originate from any of those. So I therefore found, after doing this neurosurgery for 15 years, I thought that let me focus my attention on spine surgery, and that's what I've done in the last 20 years, is focus on spine. And recently, my focus has been on back pain. And I've realized that a lot of people have back pain, but unfortunately, surgeons, neuro or ortho, the moment you do the scan, MRI scan, they say, and if they don't find anything to operate, they say, fine, this may be psychological, why don't you go and lose weight or do some exercises? Whereas if you have a spine problem which involves the joints of the spine, then it's likely that if you were to exercise, the pain would get worse. So I decided to focus on back pain. All of us at some point in our life are going to get back pain. When you're young, it's generally because of exercises that you may have done wrong. And I go to the gym fairly regularly and I find people doing the wrong things. And I stop and I occasionally tell them that if you bend down to lift heavy weights and your back isn't supported or your back isn't strong, that is the worst thing that you can do to your disc. So many disc problems arise from faulty exercise in the gym. You can then, as a young person, have disc problems or back pain because of an injury. Of course, if you have an injury, it could be injury to the bone or disc. And then, like many people have, a lifestyle that involves just sitting on the desk and sedentary lifestyle, you will find that these people have pain because their back muscles isn't strong enough. So like a bow, for instance, a bow is only good if the string is intact. And if you take a bow and the string is broken, you lose that curvature. So the spine is the same. It's like a bow. The bones of the lumbar spine and the neck, the cervical spine, it's meant to be a curve. And the muscle at the back is meant to hold it in place. Excuse me. So the moment you're sitting at work and for long hours and the muscles have gradually got weaker, then that's a recipe for back pain. And therefore, I would suggest those who ask the question, I'm at office, Garvit Shah, for instance, has asked this question that spending long hours in chair at office leads to spine injury. What can we do to prevent this? So, Garvit, the thing is, if you're sitting for long hours, I think you can get up even for a few minutes every hour or every 40 minutes. That helps. And then you walk around. So if you get up like this, you have taken the weight off your back. When you're sitting, all the weight falls. So if you're sitting flat, all the weight falls on the spine. So all the weight would be falling on that. And therefore, the L5S1 disc, the L45 disc, all that would cause pain, may cause pain. And therefore, as the moment you stand up and the weight gets transferred to the two legs, that relieves the pressure on the disc. And then gradually, as I said, the pain may settle. And if you get a chance to walk around and then come back and sit, that's one thing you can do. Then maintaining a good posture. Obviously, when you're sitting at home watching TV, you can bend forward or you are slouched backwards. So the thing is to have a straight back chair, as you see here, is what I have, a straight back chair, and always try and be as straight as possible. And if you are conscious about your back muscles, you can keep it. I can't keep it tight all the time, but be aware that that your back is straight. That may help. Also, when you are in the evening after work, maybe you can do all the extension exercises. So it's like some asanas of yoga, Dhanurasana, for instance, where your head is up and the rest of the back is curved like this. That strengthens the muscles of the back. So if it was this spine and you were to do this motion, so this being the head, the top end, and if you were to do that and do exercises of that, your physiotherapist will explain what are the extension exercises. Extension is where the back is bent backwards, and those will help with most conditions of the spine if your back muscles are strong. And if you can see, this is the natural posture if you were swimming, particularly breaststroke or freestyle. And that is why swimming is so good for the back, because it does help the back muscles to a large extent. It helps the upper limbs, the lower limbs, and the core muscles. That is what is important. So if you were to do a desk job and you had a chance to go swimming, for instance, in the evenings, 3 times a week is all that you need to do for your back. Maintaining your posture. If you don't have the facility to swim, extension exercises are important, and your therapist can tell you about that. Now, one of my favorite subjects is back pain. And to go a little bit, I mean, I get a lot of patients from Africa, from surrounding countries, and parts of India where obesity is common. And so when you're overweight, the maximum weight of your body falls on your spine. So if you're 80 kilos, if you take away the weight of the legs, about 60 kilos, 65 kilos of your body weight just falls on the spine and the disc and the bones of the lower spine when you're sitting. So if you're overweight, then the joints, and that is the other area of interest of mine. People talk about, oh, you're overweight, so you have developed arthritis of the knee or the hip. But most people, including many doctors, don't realize that just like they say, oh, you've got arthritis of the hip, almost all of these people, if they are overweight, they develop arthritis of the spine. And these are the joints, these small joints of the back which allow movement. These are the joints these small joints, the hip joint and the knee joint are big joints. And it's not uncommon to get arthritis in these big joints. But can you imagine the same thing, what's called osteoarthritis or arthritis with age? If that happens to these small joints, it can be the cause of severe back pain. Now, so to answer some more of the questions, so when obesity is causing, a lot of questions of yours relates to back pain, and to me, the worst thing possible for back pain people is somebody who does not examine the person. And if you don't examine, the first thing you'll say, oh, you have back pain, go and do an MRI. And that is the worst thing that a doctor can do. And but many people do that. And if you were to do that, not examine a person, you may miss pain in the back coming from the muscle, or pain in the back coming from the joints of the back, or pain in the back coming from the sacroiliac joints, which are common causes. In my own practice, about 20% of people with back pain have pain that's coming from this line, which is the joint, sacral, this is the sacrum, and this is the iliac, the joint here. So if you go to a doctor and I say I have back pain, and the person doesn't examine you and just sends you off for a scan, then he would miss out. And all you need to do is examine. And if that person has sacroiliac pain, you can find severe tenderness just on pressing. This person does not need an MRI. It needs something else to treat the sacroiliac pain. On the other hand, if he presses on this joint, on the spine joints, and you find severe pain, this is pain of the arthritis of the joint, now of the spine. Now, these can only be picked up if the person has bothered to examine you. And why do all patients not need an MRI? Because every person beyond a certain age, 25, 30, depending on his physical activity, is going to show some amount of aging of the spine, some disc degeneration. And there's so many MRI scans, there's so many people who report, and it will be reported as disc degeneration. And the doctor will say, see, I told you, it was a disc problem. And the patient will remember that for the rest of their lives. They will stop becoming active because they've been told they've got a disc problem. Well, it isn't everybody doesn't have a disc problem. It's a normal part of aging. So if you take 100 people from the street, and it has been done, and studies have been done where where normal people with no back pain have had MRI, and about 90% of those had some degeneration of the disc or some wear and tear of the disc related to as you grow older or related to the activity. But those are not kind of illnesses. They are not disease discs. Just like having gray hair, this is not an illness. It's just part of maturing or growing old. So people who have back pain need to be examined by specialist spine surgeons, particularly those who are interested in back pain. And then we spend time trying to sort out what is the cause of pain. Now, suppose it is the muscle. If you've played badminton or squash and you've injured yourself, well, you need it. That's a different treatment, whether you need cold therapy, cold compress, you need some stretching exercises, that's a different set of treatment. Whereas if you have joint problems in the back, what's called facet hypertrophy, facet degeneration, or sacroiliac joint pain, they require a different treatment. Either injections or sometimes radiofrequency rhizotomy, it's called, where radiofrequency current is used to numb the nerve. Back pain, because of disc degeneration, also happens, and it's up to the surgeon to determine the cause of that. Generally, when we operate on spine problems, it's because some nerve is compressed, and that causes leg pain. That is where most of our surgeries are for treating back and leg pain, not back pain alone. Back pain alone does not necessarily mean surgery, as I said. It may mean some amount of physiotherapy. It may mean some amount of rest is rarely beyond a day or two required. So I find it shocking when somebody comes and says, I've been told 1 month of bed rest. Well, if you take 1 month of bed rest, the chances are your bones will get weaker, your muscles will lose tone, and your back pain will get worse. So generally, apart from a day or two, generally, you don't need to have rest. You need to see a surgeon or you need to see a therapist and then take it from there. So that's the introduction. So I would say to all patients out there, whether in India or other places where patients come from, mainly Africa, Iraq, Afghanistan, generally, if you have pure back pain, it needs to be treated by a spine surgeon. But universally, you need to be losing weight if you're overweight. You need to be doing the right exercises, which your therapist will tell you. And then if your pain persists, then you need to see a specialist. And there are some special conditions, like if you have unusual back pain at some other point, say upper back pain or neck pain, and it's lasted beyond 2 weeks or 3 weeks, you have fever and other causes suggesting, other symptoms suggesting infection, then you may choose to, you may be investigated further to look at the causes of pain. So back pain can be caused simply by back degeneration of getting older, your muscles losing strength, or your discs really being worn out and causing pain, or there could be some disease. At times, there will be tuberculosis or some other infection. At times, cancer would have spread, like from prostate. So therefore, this breed of spine surgeons, as it were, both ortho and neuro, who spend time, who listen to your history, and who examine you, they are the best people for you. So now, having given that wide introduction, I'm just going to answer some of the questions, and then hopefully most of them will be answered. So what are the things I can do at home to reduce back pain? I've answered that. People ask, what kind of bed should I be sleeping in? What kind of mattress should I have? So generally, the mattress should be firm. I don't expect anybody to be sleeping on the floor. I don't expect somebody to be sleeping on a hard bed. A firm coir mattress is good, or they say Dunlop. If it's new, it's firm. As it grows older, obviously it should not sag, because if you've been to a cheap hotel with a bad mattress, you will realize that you will spend your nights miserable. So at home, what you can do, find the right mattress to sleep on, which should be firm but not necessarily hard. On the chairs that you sit in, you have to be erect as much as possible. While watching TV, you should not slouch back and have a bad posture for several hours. If you're sitting, get up every hour, an hour and a half, and walk around. If it is time, choose the right exercises, and your yoga instructor may be the best person. If you're not going to the gym, somebody at home who can advise you on what back strengthening and core exercises. When I say core, it doesn't mean just the back, it's the abdominal muscles as well. Because if you have a lax abdomen, it's well seen that if you have a large abdomen, the center of gravity gets displaced and your back will hurt you. So core muscle strengthening, whether you're just doing it at home, whether just doing a plank, and then toning up your back muscles, your abdominal muscles, that may help. And then generally, as I said, the extensor exercises, those involve going back. If you have a disc problem and you were doing the crunches, going forward or bending your leg forward, you may put extra stress on your disc. If you were doing weightlifting, as I mentioned earlier, you would put extra stress on your disc. So those you need to do under supervision. Darpan Mehta said, I sit around 11 hours every day in the office. How can I ensure that my spine stays fit? As I said, exercises, maintain a good posture. I've done that. Harsh Vikram has asked, what are things one can do to ensure neurological and spinal health? Well, neurological is a very vast subject, the whole of neurology, but for spine health, see, a lot of people now it's common to get a vitamin D testing, and people come and they say, for whatever is their cause, they say, they find an excuse. Now they may be overweight, they may never have exercised in their life, but they've been told your vitamin D is low, so your back muscles are, so your back is weak. Excuse me. So you're getting pain. Vitamin D, obviously, for those of us who stay indoor most of the time, it is going to be low. It does need to be corrected. And so if it's less than 20, 25, generally a doctor would say, let's treat that. And it can be treated. It needs to be taken in a dose prescribed. But that may not be the only problem with you. I mean, if you're overweight, if your muscles are weak, if your discs are weak, just latching on to correcting vitamin D is not going to solve the problem. So it must be treated. And low vitamin D has now been found to be a cause of other neurological problems like memory deficits and other problems. Obviously, if you are diabetic, you can have neuropathy, you can have nerve problems. So if somebody comes to me and says, I have back pain, and you say that they are overweight, but in addition has numbness in the legs. So then taking a proper history, you can find out if this numbness is coming because of some narrowing of the nerves in the spine, or is it because of diabetic neuropathy? So these are the things. Obviously, if you're diabetic, your sugar needs to be controlled, because if not, your nerves can get affected. So losing weight, exercise, good posture, these are the important things for spine health. If your bones, as you're growing older, particularly with women, osteoporosis is a common cause of back pain. And so a bone density scan is something I do commonly for people beyond a certain age, beyond, say, 50, for instance. And it's good to have a baseline so that if in future, there is a drop, you can say that, listen, it was normal earlier, 5 years ago, 4 years ago, and therefore, that is something that can be corrected. Why does an injured disc cause pain? Somebody asked. Well, as I said, it's the weight-bearing part, and therefore, when your whole body, particularly when you're sitting, it's like shock absorber. So what would you do if you were in a car or in a two-wheeler or three-wheeler and the shock absorber was bad? You would say, listen, let's not overload the car. You'll say, listen, utar jao, let's get some passengers off so that my car isn't bumping so much, and therefore you reduce the weight. So if the shock absorber of your car or two-wheeler is affected, till you change your shock absorbers, you would not, load your vehicle with passengers. So similarly, in the body, when your disc is degenerate or it's losing its water, it's a hydraulic system. So the way God had made it was perfect. And particularly with animals, the animals, the apes or whatever, when they were on fours and walking on fours, there wasn't any pressure on the disc or as much pressure. But the moment we became erect, we started, pressure built up on your disc. And then gradually with age, obviously, the disc, and depending on that. So if you have paratroopers, for instance, and he's doing, jumping, or you have fast bowlers who are running on hard surface, obviously the disc would get degenerate and it would lose their water content sooner than other people. So it's about how much fluid. So the first thing that you do when you look at an MRI as a surgeon, you look at, is it a white disc or a black disc? The white disc being the normal hydrated disc, and black disc is a sign that the disc has lost its water content, and therefore it could be the cause of pain. But black discs are common, and not all black discs are the cause of back pain. The more common causes are muscles of the back, joints of the back, as I mentioned. Does smoking cause spine problems? Yes, it does. And there are many centers in US where if you were a smoker, spinal operations would be refused, spinal fusions, unless it was an emergency, because there's a higher incidence of spine problems, back pain, and disc problems in people who smoke. And the results of surgery also are poorer. So people who smoke have spine problems more than those who do not smoke. And if you were to smoke, the surgeon or the center, some centers would be justified in saying, listen, the results of surgery on you is not going to be good. So, you may not get surgery. And especially this kind of surgery, which is back pain. It's difficult to treat back pain unless we focus on the cause of pain. And sometimes surgery makes it worse, particularly if you are chronic smokers and you don't give up smoking. Another person has asked, what can I do to avoid neck surgery? Well, again, with the neck, posture is important. And, when I see school children carrying 10, 15 kilos of school books in their back, and it's hanging from the neck, hanging from the shoulders. And I said, this person is going to get neck pain at some point in their life, and sooner rather than later. And I have seen children who have complained of neck pain, and of course they've had scans and x-rays. But then when I asked them, how do you carry your bags and how much weight does it have? And then I realized that, this is unfair. So starting from childhood, we strain the neck, carrying books to school, and then mature to carry laptops and other heavy bags, or ladies with shopping bag. So when I have a lady who comes into my office and says, I have neck pain, and I find her huge, which is fashionable these days, to carry a huge big bag. And I lift it up and I said, my God, where have you been? What have you, how long have you been carrying this? Doctor, that's not the cause. And I said, yes, it is. So try not carrying it for a while. And therefore I've seen, which is common abroad, of people with problems carrying their work papers and laptop on a stroller on wheels. So I have yet to see a woman carry her purse on wheels, but I think if you are going to carry a heavy purse, perhaps you should be carrying a stroller around. But so that is one thing. So start by not lifting heavy weights, and then gradually maintain your posture. Do not do exercises in the gym, and this is particularly for the neck if it's unsupervised. So if you were to do really heavy weight lifting, that will affect your disc. Or if you were pulling down weights, again, if your muscles are not strong, that can be a problem. And if you get muscle pain in the neck, do not jump and go to a chiropractor or a massage wala or wali who says, listen, let me just bring your neck back, and then they shake it. And I've seen fractures and dislocations of C1, C2, the top bones of the cervical spine, simply from sudden jerking of the neck. In some cases, in one lady's case, it was a congenital spine weakness, which got worse and dislocated, required urgent surgery. And in many cases, it's the start of something else. Chronic neck pain can be tuberculosis or something like that. And when the pain has lasted beyond 2 weeks or 3 weeks, people are desperate and they then go to anybody, a non-trained person who manipulates the neck. So a neck that is already weak and gets manipulated can lead to serious, serious neurological problems. But for most people, this is not that there is TB or there is cancer, something serious. For most people, it is just bad posture, neck muscle weakness, and those will be apparent when we examine them. And the curvature, the normal curvature, which should be curved, the neck starts bending forward, and the muscle, because the muscles are weak, and therefore that's a chronic neck pain. Recently, just like I said, joints of the lower back, people have joint pain in their neck from joint problems, similar, just like their joints below, their joints in the neck that allow neck movement. Gradually, with aging and poor muscle tone and strength, you can develop neck arthritis of the neck joints. And these also have to be picked up by examination, a careful examination, picking up the painful joints, and then treating that. And these people can be miserable. And now when I've identified the neck joint as a cause of pain, and they have been through physiotherapy and labeled as psychiatric patients, and I've examined them and I said, listen, what bothers you? And they said, we can't sleep. Because if you're somebody like me, who sleeps on the side like this on my head, can you imagine if I had arthritis of that joint, it would be painful. And for somebody like that to not be able to sleep, and the moment we have treated, either with injections or radio frequency laser, they said, God, I never realized that I could sleep 6 hours without pain. So those of us who are interested in back pain, in neck pain, we have this group of patients who really thank us just to do simple things, to be able to sit pain-free, to be able to sleep at night pain-free. So what can you do? Maintain your posture, do your exercises, keep your weight down. Okay, to the next question. When do most people develop back pain was a question. Well, most people develop back pain, as I said, at some point in their life, depending if they're active, if it's sports-related injury and poor physical fitness, it happens in younger age. And then poor physical fitness and other diseases, poor abdominal musculature, poor back muscles, disc problems, all these things happen as the age goes on. So if you're very senior, you've never had back pain, and then you have to ask the history if you are treating that person. What is your history? And he said, listen, 3 years ago, I was treated for prostate cancer, and I've got this sudden back pain, which came on a month ago. Then the first thing that comes to mind is this connected with that disease? Or if the person says that I've had fever, I've had night sweats, I've lost weight, and I have back pain, then you think, is there some infection like TB, or is there something sinister happening? So it's about when somebody is treating back pain, of course, he has to be sympathetic to your pain and has to listen to your story and then has to examine you. The MRI or X-ray is the last thing. That's the last thing I do after I've made a diagnosis. I then decide what investigation. Most of the time, by the time people have come to me, they've had their investigations, and I say, can you tell me what is wrong with you? Or what are your complaints? Yeah, I have disc. I have a disc. I have L4-5 disc. That's because, as I mentioned earlier, they've been scanned without somebody examining them. Okay, so now some more questions. So somebody from Myanmar, somebody has asked, doing MRI of the spine, does the cycle, I presume they mean the periods, does that change? Because she's had 2 MRIs and after that she stopped her period. So that is not something that I'm aware of, and I don't think it would have any effect. Until now, MRI is done even to pregnant women, and it's told that there are no known side effects. So I don't think it's connected. And sir, I would suggest that you get your wife to see an endocrinologist or a gynecologist. Another, Muhammad Salim has asked, sir, my aunt has severe knee pain. Her age is 50. Is injections in the knee useful for her? Your consultation. So, Muhammad, I'm not a knee surgeon. I'm a spine surgeon and a neurosurgeon. So, injections in the knee, I think your orthopedic surgeon doctor would be the best person. But from my experience, if it's a pure knee pain, various therapies are tried and physiotherapy is tried and exercises are tried before injections are suggested. And after that, knee replacement is the last. But I am not an authority on knees. I'd suggest you see an orthopedic surgeon. Another question from Mr. Faridun. Sir, kindly explain about meningioma. Well, is operation required? I presume, Faridun, you're talking about meningiomas of the spine. These are benign tumors of the spine and, of course, and brain. So if you're talking about spine only, can you explain about meningiomas, he asked? Well, these are benign tumors, but there is no way of confirming that a tumor is meningioma till it's operated upon. So once there is a tumor called meningioma, like a meningioma in the spine, and it's pressing on the spinal cord or nerves, they need to be operated. And only after that is it diagnosed whether it's a meningioma or a neurofibroma or some other kind of tumor. So your surgeon will be the best person. Generally, if it's a meningioma, it's near the spinal cord. So it's not an orthopedic problem, it's a neurosurgical problem. So any neurosurgeon will be able to advise you. If it's really small, he may choose to keep it under observation if it's not pressing on the spinal cord. On the other hand, if it's pressing on the nerves, they may need surgery. Another question from Mr. Hari Krishnan Pandey. Sir, I had suffered from chronic peripheral neuropathic pain in both feet. It became very difficult gradually, my aging. I'm 60 now. Are there any special treatment? Mr. Pandey, if you have seen a neurologist and he has diagnosed peripheral neuropathic pain, I am sure he would have prescribed medicine for neuropathic pain. And what he needs to be sure, and if you're not sure, then you should see a neurosurgeon who can examine you and tell you if the neuropathic pain is indeed neuropathic pain or some other cause of pain in the feet which is arising from the spine. But most likely, if your diagnosis is peripheral neuropathic pain, you've seen your neurologist, and there are some medicines that can help the pain. If you are a diabetic, that can be the cause of peripheral neuropathy and neuropathic pain. So the first thing to do is to control the sugar if it's not controlled already. Okay, there's some more questions from Gopal Ji Bhatt. My disease is bipolar disorder. How can it be cured? I think we've gone away from spine, but I think you should see a psychiatrist, not a psychologist, not a neurologist. These are best treated by a psychiatrist. Can it be cured? A psychiatrist will tell you that long periods of treatment is required. Rohini Prasad asked the question, do you recommend any stretches, exercise for back pain from sitting at the computer for long hours? Yes, obviously, you should exercise and you should stretch if you are sitting at the computer for long. So as I said, just getting up is good enough from your chair. But if you get up and stretch, and maybe on another occasion we can demonstrate the exercises one can do in the office. And And for most people at desk work, they will need to see. And I think we will have another session with our physiotherapist where I will actually get her to demonstrate to you the stretches that we need to do. But thank you for your question, and we will keep it for another day. Mahesh has asked, I have a 2-year-old baby, totally senseless. He cannot respond. Anything help me, sir? So Maheshji, I'm really sorry to hear that. And I think if the baby was born like this and is now 2 years old, you need to see a pediatric neurologist, and they will tell you. Obviously, there are babies born with a weak brain. Sometimes it's called cerebral palsy and some other conditions, and other defects because of pregnancy and birth-related issues affecting the brain. And these can be managed by seeing a pediatric neurologist and then physio and occupational therapist, physiotherapist and occupational therapist, and then speech therapist. So we have major centers have these team, what's called neuro rehabilitation team, and they can guide you. Somebody else asked, is it possible to correct inguinal hernia without using mesh? Well, Sissy, this question be best asked from a general surgeon. I'm a neurosurgeon, and I know meshes are used in inguinal hernia, but probably it's best to ask a general surgeon. But if you ask me, from my memory of general surgery days, 35 years ago, yes, it was possible to do hernia surgery without mesh. Another question from Suleiman, could I get your opinion on prescription about problem with my lumbar vertebra by bending? So, yeah, I think you need to see a back doctor, Suleiman, and a back doctor or an ortho or a neuro, whoever is easily available. And then to see, that is what I've explained in the first 15 minutes of this interaction, is that your doctor should be able to tell you that is it coming from the vertebra, or is it coming from the disc, or is it coming from the muscle? So I think you need to see a doctor about that. And you have to be specific. And otherwise, some doctors may just say, listen, you've got back pain, just go and do exercise. And I think most patients with chronic back pain should ask their doctor, but doc, what do you think is the cause of my back pain? And most back pains, as I said, would be muscular. If you pushed the furniture or lifted a chair, you have a bit of back sprain, that is muscular. But if it goes beyond a week, 2 weeks, and what we call chronic back pain, if it's beyond 3 weeks or 4 weeks, that is when you need a specialist. Okay, so any more questions? Somebody from Pakistan, Ziaur Rahman Khan, how do I get an appointment from Pakistan? I think if you contact the Apollo Hospital directly or send them a mail, they will fix up an appointment. We have many patients from Pakistan, and generally the hospital helps with the visa, and visa generally is not a problem. And a lot of patients from Pakistan who visit, and a majority of them come to our hospital, visa is not a problem. Okay, any more questions? Okay, so you can send your questions directly to me at neurosurgeryindia@gmail.com, which is NEURO, neurosurgery, SURGERY, India, INDIA, as one word, neurosurgeryindia@gmail.com. So you can send your queries there or to Apollo Hospital. And for appointments, you ring 9717 9717369. So I repeat that, 9717687 So it's been nice interacting with you. There have been a lot of questions which we can answer separately. But basically, to summarize, stay fit, have a good, healthy diet. I haven't spoken about that, but low carbohydrate diet, higher on protein. It doesn't have to be non-vegetarian. You can have a good, healthy vegetarian diet. Avoid fats completely. Fats are bad for you and bad for your general health. Low carbohydrates in the long term, that is what will help you prevent weight gain. So keep your diet under control, do regular exercises, do yoga or some form of spine exercises, stretching exercises. Avoid lifting heavy weights unless you're trained to do so or in the gym under supervision. If you're sitting for long hours, maintain a good posture. Get up, do your stretching, just walk around, come back. Swim if you can 3 days a week. Brisk walking is good with a good posture. Brisk walking is good for your back. And if you have short period of pain of 1 week or 2 weeks, you can see your local therapist. But if it goes beyond that, it would need investigation. And if your local GP has treated it, fine. If it goes beyond 3 weeks, you need to see an orthopedic or neurosurgeon, or if there is a specialized spine surgeon near you, you see that person. And if you're here in Delhi, do drop in to see us if you have a problem. Thank you very much. Have a good evening.